To everyone. Welcome to Dr. Biswajit Speaks, and thank you, Akashvani Bhubaneswar, for this opportunity this Thursday. So I'll just start with one thing, that we doctors, we are always looking towards this world, with a very specific lens in our eyes. And this lens has been given to us during our medical profession, medical training, and whatever you call, in so many years of practice. And we have never changed that lens. And so through that lens, we never see ourselves as a human being. We see ourselves as something big, as servant of the whole humankind, and the whole responsibility, as if the whole responsibility we people have taken into our hand to do everything good for others. As a human being, who calls us, who now, as per today, who is calling us a human being? Starting from think of at our home, people, our family calls us as workaholics because we are always with the patients. Fine. When we come to the hospital, they call us as they are paid servants. They are paid people. We'll pay them and they'll work for 8 hours, 10 hours, 12 hours, 18 hours, whatever things, whenever the patient comes. When it comes to the government, then they are telling these are the people whom we have appointed so that they will do the free service to the humankind, because they have chosen a profession where they have to serve the humankind. This is the hospital, this is the government, this is the people, and people think, what? People think these are the group of people who are God. They tell us like God. I don't know from their heart or from their mind, but they call us God. Sometimes they call us God, and sometimes they call us demon. So I don't know. Nobody is calling us human beings. Neither we are calling us a human being. So I thought, let us rethink: are we human beings in any way, or are we just a puppet or something like that, which has been created by us? So we'll discuss on this topic today, and so I'll start sharing so that we can discuss nicely with that few slides. So today, I will tell you, it's a time has come to change that lens. We should wear some other lens also. That is what is the main aim of this particular thing. So here comes the compassion without self-care. Here comes the particularly a very important word called self-care, which is missing all throughout. All throughout every doctors, if I talk about, including myself, I also did the same mistake long back. So this self-care, there is compassion without self-care becomes a self-destruction. Somewhere, everybody in their life, in doctor's life, we have destroyed some of our this body. We have not done justice to this body. You know why I'm sitting here today in front of you all? Because from 98 to 2010, I was working 24 into 7 into 365, and it's 17 to 80 hours a day, every day in the OT. I don't know when I used to sleep. I never knew when I used to eat. Every day morning I used to take one omeprazole that time. Every day, and OT I used to wear a belt because I used to have severe backache. And in 2011, 12, 10, I had a problem. And that was the first time I had an introspection. And that day when I was asking what mistake I did, I found out that I did good to everyone, to my patients, to my doctor, to my hospital, to my society, to my everyone, except I didn't do justice to myself. And that day I decided to start doing justice to myself, and that was the day. And today, if I'm sitting in front of you, is because of that thought. Let me take self-care. How to stop my medications, which I was started, and all the thing got stopped because I started thinking, and that became my mission. That's why this organization called GSHER, Global Self-Health Care Education and Research. That means self-care is the best care. And here I remind everyone, not only, this is the first time I'm coming to doctors to remind that we are also human beings, and we also need to take care of ourselves. That is the main motto of this program. See, just look at this picture. When we are trained to serve, to sacrifice, to take a wonderful decision, to decide the best of the decision we have to take. We have to treat people, we have to operate, counsel, reassure, and so many things. And we have to remain strong, whatever it may happen to us. I used to take a paracetamol tablet because I used to have 4 OT in the morning. Okay. But behind that, these white coats and this confident face and the skillful hand, we are person with emotions. We have a family responsibility. We also undergo fatigue. We have our own fear. We also have our own guilt. And fine, we have our own expectations. But there is nobody is talking about this all over the world. The same thing. Nobody talk about these things about doctors. Only we have to. We even ourselves also sometimes we don't know much about this. We somewhere where we missed the bus, where we did the thing. So why this episode I have created for you? Because we listen to every patient every day. I always say. So I always say that we doctors also have one body, one mind, one nervous system, one family, one life. But there are so many people, so many things to do, and we go on every day with multitasking. Somebody must be having an administrative job, somebody must be having simultaneously doing surgical job, seeing a physician, indoor, outdoor. There's a family responsibility. So many things goes together. So our society expects from us our availability, our accuracy, our compassion, our confidence, our emotional stability. This is the expectation of the society as per today. But we also carry this thing. This is the missing things which we never show it to the society. We never show it to anybody. That our tiredness we have never shown. Our fear we have never shown. Our legal pressure, family sacrifices, nobody has seen. So this is the end of the things. We will be knowing that doing a self-reflection. We will discuss out a practical solution in future somewhere, and that we have a professional dignity. And this is to help doctors to protect compassion, judgment, family connection, and biological resilience. This is very important, which we do not ever discuss. I've taken a small story with this. This story quietly goes with this particular episode. This is about we call the mangoes, and a family had a mangoes, their own pet. Fine. One day, what happened? They left the child with the mangoes, and these parents they went out. And after some time, the parents were out. A snake entered to the child's room. You know what? And the mangoes was very much loyal. So that mangoes fought with the snake and killed that snake. And he was proud that he protected the child. Fine. And we know what happened. And with that mood that I protected, with the proudness, he was standing in front of the door. Fine. To show that when their these parents will come, this child's parent will come, he will be getting thankfulness. And after some time, the parents returned. And they saw that the mangoes had blood in his face. And they thought that this mangoes has killed that child. So without thinking anything, they started beating that mangoes and killed that mangoes. And that after that, when they entered the house, they found that their child was safe. The child was safe. It was a momentary, or you can say it was a hasty decision, or it was it was the fear which has killed that mangoes, which was so loyal to them. That means when the mind was in a hurry, assumption replaces assessment. And this is what is exactly happening to us every day. We are tired. Fatigue this is what is, when we are fatigued, our mind gets distorted. Our judgment becomes sometimes, not sometimes, many of the time when we are fatigued, our judgment is also wrong. Our communication becomes different. Our relationship with our family also suffers. Fine. So a tired doctors may speak harshly also, miss documentation, assumption intention, think of a resident doctor or a freshly graduated or postgraduates who work for 17 to 18 hours, 20 hours. Even I used to work that time for 15, 20 years. Fine. So naturally those things will come. But those things has its own, results also, implications also. For that also bring again, that goes on adding, and we get more and more frustrated. An overloaded mind loses the pause, narrow attention, react defensively, and misread risk. This is what we call today that negligence or something like that, which is coming up. There are a lot of things happening around in the hospitals. We listen, we just get in the news, and it has happened to, I think every doctor has passed through these things. And don't you think this is somewhere these things, things happening somewhere? Our judgment is getting distorted because of the our own fatigue. And a restored doctor will listen better, decide clearly, communicate calmly, protect dignity. This is where our self-care comes into the picture. Self-care is not withdrawal from duty. Sometimes when I teach self-care to people, because we have, I think on July, we are going to launch the self-health care education diploma. It's a certificate course through Odisha State Open University. It is basically to teach people that self-care is not selfishness, because most of the people they tell us, sir, you are teaching us to be selfish. I told no. When I take my self-care, if I make myself better, then I am making myself to serve more, thousands and thousands people more. If I'm not there tomorrow, then what can I do? I'm missing. So I cannot serve anyone. So self-care is somewhere to be introduced into our medical system, and especially a very important thing, important step, which will change the whole scenario. So everybody in our training teaches us to rush, to do, but nobody has taught us to take a pause. Pause is very important in our life. But everywhere, not only in our profession, the younger generation, in every field, you will say, then the training is going towards rushing, to do, finish the work. But we forget that a pause can make a lot of difference in our decision making. Because the moment you take a pause, you verify the things, you get a better chance to communicate, you can do the documentation better, and you can recover the things yourself and the situation better. That is what is, because the moment we start thinking ourselves as a human, I think this is going to come. We have our own emotional fatigue. That exhaustion that comes from repeatedly absorbing human distress. The hospital is a place of negativity. If you see, all the sickness is there in the hospital. We are absorbing the human distress every moment, and we think it is normal, because we normalize that. Because you think just see the slide, we absorb pain, fear, death, complications, complaints, expectations, uncertainty, everything in the hospital. Because the moment we enter the hospital, these are the things which are already there, and we absorb those energy, and we become a part of that, and we become irritable, and our empathy goes down. Our sleep, that insomnia, insomnia, cynicism, emotional numbness, loss of joy is a part of. We become totally imperfect. Fine. So we make them as a normalize. Fine. So normalization is a part of profession, because we think they are normal things. They are not normal things. These are things we are facing. But the moment we normalize them, it weakens our judgment, damage our family connection, and it becomes our burnout become very much visible to everyone. So I will tell one thing very simply, that everything common is not normal. What we see every day around us is not normal. Everything tolerated is not healthy. Every day, if I'm now, when I'm a OT superintendent of a hospital, and when I see the way the things are going on sometimes by the management, I tolerate to a certain extent. But thing has become so intolerable, then I have to resign from the post. Because the moment till you take it as normal, you can go with that stress. But a time will come when it cannot be normal. You should not normalize them. You should not tolerate the things. And we all are tolerating everyone, from patients to our administrator to our hospital owners to senior doctors, whatever you say. We all are tolerating. somewhere we think this is normal. No, it's not normal. Normal is something different. And we are normalizing that. That's why we are facing the problem. So here, our emotionally, every doctor, if I'm not wrong, every doctor is emotionally unstable. But we never think about that. It is not a generalized statement. It is a practical. I am emotionally unstable most of the times when I enter the hospital. The moment I see so many things, so much of work, so many of things going on which is against our ethics, I get tensed. It's my moral get something, I get disturbed. I don't know. But it is also emotionally, that means I'm emotionally disturbed. And every day you are facing, there is no medicine, there is nothing, this patient does not get this medicine, the sister has not done the work, the hospital has not provided this thing. So all these things are going to be there. And here, the moment you start thinking, we should not normalize them. We think, yes, there is a problem with us. How can we disconnect from that particular thing? Because disconnection is the only solution from that. I resigned from my post because of that. When? Yes, sir. That is the reason why I am talking this topic. Let us finish, sir, then we'll discuss out, sir. Fine. We will discuss out because I am putting the things which are the things which we cannot see as a doctor with the lens which you are wearing. I want to remove that little bit. Sometimes we have to remove that lens and see as a human being also. That is what my aim is. So let me finish the thing, then we'll discuss, sir. Okay. So this is a family neglect. I always say the silent cost which we all has undergone, and the new generation is also going to face. So this is basically, I want to guide the new generation so that they will be prepared, because something if we are not telling them, because the things which is not in their mind, I cannot see it. Fine. And that is the reason, because somewhere we are teaching them one-sided and other part is missing. So we have to have a total holistic one. A person is also important and the patients are also important. And it is a total society, but here I personally has suffered because of my over dedication. So somehow we have to balance. So now our family, what family experiences, missed dinner, missed school events, interrupted festivals, it's all, everybody has gone through this. The invisible emergency bell, fine. And what doctors can do, we can create protected recovery time. We should have a particular working environment also. Communicate guilt openly. So many of the times we carry a lot of guilt inside. Today I couldn't reach my home, so I had a guilt, but whom I'm going to share? If I go to share with my wife, then again, I cannot tell the whole thing why I didn't, what is the importance of that patient? Because there are a lot of things we cannot, but there has to be a forum. This is a forum which you have created to share such thing. In future, we'll be sharing these things. And whenever we are coming from the hospital, leave the hospital at the door, which is not happening. Fine, it is not happening. Any time it is not happening. Fine. And schedule family presence, which is not happening. Define true emergencies. True emergencies means many of the times, most of the people, they come to us thinking that this is an emergency, and actually we should always, in 80% time, it is not an emergency. So we have to somewhere find what is it really emergency, what is not an emergency. Nobody is wrong. If you see in whole this family neglect, everybody is right. But everyone is affected also. Nobody is wrong, but everyone is affected somewhere. This is where we have to work. And our next generation has to be guided in that particular thing. A work-life balance, which we are talking about, that is necessary. And that has to be a part of our training session. Fine. What is the performance patient? This is always a performance for all the surgeons, physicians, because everybody expects us clinically perfect. Fine. But it is not, because we are, the modern medicine, what you say, it is a science of imperfection. It's a science of it, because with all the information comes to us, is are not complete. With that incomplete and imperfect information, we have to give perfect results. So it's a pressure for us. Legally safety, emotionally calm. You are now a person, now when you enter the OPD or enter the operation theatre, and wherever you go, there are lot of things which are against your, planning or against your wish. So you have to emotionally calm down. It is very, and that everybody expects us that we should be calm always. We should be financially successful. We should, this is the first thing we always think, we should be financially successful, but how? Who is paying us? Now that comes to things. Now for that, financial successful is a particular word. This is a performance pressure. There's somewhere we have to be successful, so we have to do certain things. Now what are the certain things? Is it ethical, non-ethical? So we have to have a clear-cut guidelines. Among that is not somebody will tell us. It should be within us. Fine. When I see this, I should, because it's a doctor's forum, I can speak. When I see the new gen operating in the operation theatre with a diploma, with a fellowship and all the things, with a skill is so bad. Because they need time to learn. Because skill is a thing which comes with time. It doesn't come with a fellowship. But they, with the fellowship certification, people are doing complications left and right. And our hospitals and our authority, corporates, everybody is allowing it. Because even I can say NMC and DNB board is responsible to a quite extent to this. Nobody is looking at that. Today, if you read my article in my Art of Self-Health Care, I have written a very nice article on this also. Fine.
That's not the thing. Actually, what there is a dilemma in the crossroads of requirement of the society and requirements of the profession. So,
sir, I am talking about doctors only. Today I am talking about doctors only, sir. This is I am talking about how we are, our performance pressure is there. So we are socially, we have to gain social respect also. That is also a pressure for how to get the respect. And our dignity, we are nowadays digital presence is also very much essential. There are most of the people who are senior people, now they are not digitally visible. But there is a pressure for them, sir, people come to them, say you do this, you will be visible on that. So do we record visibility? But it is with the changing time, we are coming under the pressure of digital visibility, academically updated, because modern medicine is changing every day. So there is a pressure which is with us, performance pressure always, that you should be academically updated. Yes, it is necessary, but it is also a pressure. And the most important thing is everybody wants that the doctor will be always available. That is a unseen pressure. Always creating that if I don't see the patient in that particular time, if something happens, I will be behind the bar, or I will be considered negligible. Why? That is the thing, because this is where our performance pressure is coming. The human being cannot live permanently in performance mode. We are always in a performance mode. I will try to remember what is a performance mode. Performance mode means your body, your cells are in a cortisol flood. Cortisol is getting flooded in your body, in your circulation. Because the moment you think of performance, your cells perceive it as a stress, or I think it is something, we need something, we have to do more. So you are always, so a particular spike of cortisol is okay, stress is okay, but not the stress. Because that is damaging us. That is the reason why 60% of doctors have hypertension, diabetes, and there's so many, you name a disease, we are also a part of. Though we talk about diseases, we are harboring all the diseases with us. Fine. That's the reason which I had a problem in that particular time, because of the performance mode. And now I will talk to you about the cellular perspective. What is cellular? For the first time, I'm telling you, cellular is trademarking under my organization, that I call it revival at the cellular level. We all have to understand the thing at the cellular level. What is happening? If I'm working, if I'm taking rest, what is happening in my body? That's why I'm talking about the performance mode. That is, at the cellular level, every moment, every instruction, every word we say is having an information. It's reaching to our cells, and our cells behave in that particular signal. So chronic stress signals reach the cells, the body shifts into survival mode, recovery becomes a clinical necessity for the doctors too. We also need, because we also want to bring that cortisol level to a certain level. We have to, every day we have to do that. Are we doing something to bring that cortisol level to down? We don't do. Are we adopting, or are we, like in 2011-10 when we had a problem, I was looking for how to bring my life back to normalcy. I was looking for alternative therapies like yoga, nutrition, and everything. I visited to almost all professionals and ultimately after 6 months, I found that there is nothing Nobody is telling you anything, giving you anything good. Everybody is selling in a fragmented health. Everybody is telling they have a solution to you. You take this, you will be all right. You take this, you do your asanas, you do this, you do this. All the things are happening. So I found it's a health market, which is bigger than disease market, is also fragmented. I was surprised, and that's why I had to unlearn many things. I have to relearn the things. And today, if you see the cellular protocol, which is for everything, and it is going to, I know it is going to bring us revolution in future. We are just starting. And this protocol is going to give, because it is a total, your biology, your nutrition, your physiology, everything, how to bring them together. We doctors have the knowledge. We have the knowledge, our physiology knowledge, anatomy knowledge, biochemistry knowledge, but we have never applied the knowledge to in our body. We have always think in terms of diseases. So that is where our doctor's role will come, and where we have to bring from performance mode to the rest and restore mode, and where our body will be with parasympathetic stimulation, which we need, because sympathetic stimulation overload or cortisol overload is causing damage to our cells, damage to our artery, damage to our everything body. So doctors must not only manage patients, doctors must also manage their own biology. Here I use a new word that is called biological intelligence. In this era of AI, I talk about BI. And BI is millions times superior to AI. Because our cells are, what do you say? They are more intelligent than anything, because AI is 50 years old and BI is 250 billion years old. So intelligence is lying inside us. We have to reactivate them. So this is what my whole of my life, rest of my life, I am going to spend on this cellular protocol to spread the message. How this thing, and today also we'll discuss a little bit about that. So a solution framework, I always say, the 5 pause formula: small pauses protect judgment, dignity, and compassion. So a pauses, small pauses is required before reaction. Protect dignity before responding to anger. Fine. We have to take a pause. Before injunction, take a pause, verify before judging. The moment you take a pause, you will be verifying your judgment. Before returning home, leave the hospital at the door. Take some time, take a pause and leave it at their door. Before saying yes, because we doctors somehow we never know how to say no. When a patient will, I remember initial phase of that during that before 2010, patient will tell, sir, you are available. I'll say, yes, I'm available. That was suppose 7:30. So I'm coming in 15 minutes. And I will wait till 9 o'clock. Then person will come with a bag of his vegetables, and he will tell, sir, sorry, sir, I had to take the vegetables. So I used to wait for so many times because I told them yes. And when I started telling no, as for today, and last, I think more than 10 years, I don't see patient after 7 o'clock. I don't see patient after 7 o'clock. I operate only 2 cases a day. After 2 o'clock nowadays, I don't go to hospitals. I don't see any patients. I am spending my time in improving the things which I wanted to, like my area of, where I want to contribute to the society. So before saying yes, we all have to understand, we have to say no. And we have to understand what is the emergency, what not emergency. Who will take care? There are people who already on duty to take the care of emergency. Not everyone should be present in during emergency period. Self-care, sleep, food, movement, and silence as professional maintenance. We have to undergo everything just like any normal human being. So the moment we remove that lens as a doctor, and we will think we're a human being, then we will do everything. We have to have 6 to 7 hours of sleep. We have to take food in the proper time. Our movement, exercises has to be a part of our life. Silence is necessary. We need pause for our maintenance. The pause is not weakness, it is professional intelligence. When I stopped seeing patient in the evening hours, a lot of people, they started telling me, sir, aap shaam ko patient nahi dekhte ho. I told, no, come tomorrow morning, I'll see you. And today, every patient come to me in the morning hours within the 2 o'clock, and not a single patient get missed. And my patient number has never decreased. My income has never decreased. Nothing. I never had. Now I can do a lot of things which I think will be added to this. Fine. So this is what the cellular protocol. Cellular protocol goes with only 4 phases. I always call them reset, revive, reprogram, and restoration. I have a protocol for hypertension. I have a protocol for the diabetes. I have a protocol for everything, stress, anxiety, for cellular protocol success, for leadership. I have created all the protocols, but with these 4 set of things. So in the reset phase is what, like the moment we think we want to do something for us, so people directly go to the revive phase. They start doing yoga, they start taking good food, they start taking so many things. All the menus are available in the health market, we consume those things. But they forget that their body, which they are using this, your body is already in a unrest phase. You have to reset it first. You have to bring them into a position where it will receive. Fine, this noise has to be reduced. So reset is a phase where we reduce the noise and we have to decide how come I have become this. So that need an introspection, that need a pause. Fine. So here you are training your nervous system, you are remembering the things which has created, which have brought you to this particular position. And then all these things will help. Breathe, silence, sleep, emotional unfolding, these all things will think. And revive is the phase. Then once you reset yourself, go to the revive phase. That is where the nutrition, exercises, sunlight, hydration, recovery will work. Because now you're energizing yourself. Because now the signal, which was before it was hidden by the noises, which now your cell will start listening to your new signals which are giving. And now comes the reprogramming, because reprogramming is a phase where you affirm yourself to be a different person. You want to take care of yourself. A good doctor need not sacrifice everything. A good doctor is a person who take care of himself, and with that, he keeps himself ready to serve more and more people, more and more patients. Fine. So because it is the thing that day I realize, if I am not there tomorrow, what's the meaning of this whole doing I am doing? If I am there tomorrow, then I will be serve millions of people in my future. So restoration restoration is a meaning we give with the habit we develop, and we have to keep the development continue. So this is a cellular protocol, 4 pillars on which we talk. So a healthy society needs healthy doctors. This is the tagline which, if I tell you today, we have to be healthy first to create a healthy society. This is where our role is more important, because doctors are the best counselor, doctors are the best guide, doctors are the best mentors. Because we have so much of experience, so much of knowledge. We're the cream of the society, but we spend most of the life seeing diseases. This is there. This is our skill, but our knowledge goes with us only. We all doctors go to the grave with the knowledge with us. And I always say we should be the knowledge brokers, because the knowledge we gain what I gained in my 30 years of practice is a gold. It's a gold. And I cannot go with that gold to my grave. I have to distribute it to my people. That is what is my aim and objectives. So we all can be Mr. Roy, sir. Sir, these are all problems, sir. Yes, sir. These are all problems there. But all the problems has got a solution. And everything in the whole world, if we see any changes has come, it has come through the education, it has come through the motivation, it comes through the leadership. So we doctors has to be good leaders. So leadership quality is lacking in doctors. So somewhere, if I look into myself somewhere, the way I used to react, the way I used to think, because everything is within us. Because we can't expect changes from outside immediately, but the changes can, if we change ourselves and we start doing, people will show you.